Welcome to the Dental Journey podcast series brought to you by the Indian Dental Association UK. I'm Biju Ramachandran, and it's my great pleasure to introduce today's distinguished guest, Dr. Devang Patel. Dr. Dev is a visiting lecturer in restorative dental practice at University College London, King's College London, and Brighton and Sussex Medical School. He is also a best-selling author known for his book Full Mouth Reconstruction for GDPs. Dr. Dev graduated from India in 2004 and completed IQ examination, enabling him to begin his career in the UK. His professional journey has been marked by a profound interest in aesthetic and restorative dentistry, including implant dentistry. Committed to excellence, Dr. Dev has pursued numerous postgraduate courses, including a one-year full-time MSc course at Eastman Dental Institute, where he was awarded a distinction and a postgraduate prize for excellence in clinical and academic achievement. Renowned as the FMR guy, Dr. Dev specializes in treating patients with severe tooth surface loss and complex fixed prosthodontics using implants. His expertise extends to procedures such as autogenous bone grafting, sinus lifts, and full mouth rehabilitation. In addition to his private practice, Dr. Dev is dedicated to educating the next generation of dentists. He teaches postgraduate courses at University College London, King's College London, Brighton and Sussex Medical School, and numerous other institutions, helping dentists advance their careers in restorative dentistry. Thank you for joining us, and I hope you enjoy this enlightening conversation with Dr. Devang Patel. Welcome, Dr. Devang Patel.
Thank you very much, Biju, for inviting me. It's my pleasure to be in this platform. And as I said, I'm really excited to be speaking at IDA conference as well. And again, thank you very much for giving me this opportunity.
Dr. Dev, we are eager to know about your journey into dentistry. Please tell us about your educational background and who or what inspired you to enter this field.
Well, it's kind of an anti-climax. So I come from family of doctors where my grandfather was a doctor, my father was a doctor, my brother is doctor, my both uncle are doctors, and so from the childhood I was told that you're going to be a doctor, as it was in those days. And so when I got into my 12th standard, which is sort of A level in UK, I did very well. I had 87% in my sciences, but I still couldn't get admission into medicine or dentistry. So ultimately, my grandfather had to pay something called donation fees, which is completely legal, to get into dentistry. And the whole reason I went into dentistry is because the fees for the medicine was double than what it was for dentistry. So I wanted to make sure I didn't want to burden my family too much. So I said, you know what, let's do dentistry. So purely financial reasons. I did not have a clue how many teeth we have. And we have a baby teeth and an adult teeth and how many baby. I had no idea. I was also from a Gujarati medium, so my undergrad, my study in 12th standard was Gujarati. I had the sciences in Gujarati and everything. So going into dentistry straight was tough because everything was in English and I could not understand a word of it. But the decision was really financial based. My grandfather was and is still my hero, and I was inspired by him, the care he took for his patients and everything. So I wanted to do something really patient-based, and dentistry seemed really good choice because it's a 9-to-5 job. I've seen my grandfather doing lots of late-night calls. My both uncles are gynecologists, so they have done late-night calls, and I didn't really want to do that. And that's how I went into dentistry.
Great. I think most of us Indian dentists can easily relate to a choice. Your story is very inspiring, and we thank your hero, your grandfather. Next question. You've become quite renowned as the FMR guy. What sparked your interest in full mouth rehabilitation?
Well, that's also as an anticlimax in the sense that I did not start my journey thinking that I will be a full mouth FMR guy. I graduated in 2003 and I really wanted to become an orthodontist really. At that time it was cool, still cool, but I really wanted to become an orthodontist. So I again went to my grandfather and I said, you know what, I want to do MDS in ortho. And he said, look, there is an IQE exam coming up in India and my aunt was keeping going on and on about like how great UK is for dentistry. So he said, look, appear for that exam. If you fail, we'll get you into MDS. Again, by donation, because I wasn't good enough to get into free seat. So I said, okay, you know what, I'll go and do the exam. I passed the exam. I passed part B and C. And that's how my journey started in UK. And when I started, I then realized quickly how bad I was at doing dentistry. I used to do like a premolar root canal using single GP point and not even like 15 number GP point. I did not know how to mix Pentamix. My nurse taught me really how to take proper impressions. But I really wanted to become a good dentist. So I did 2 one-year certificate course. I went to different mini courses. I did my MJDF. I still could not do complex cases. And what happened was that I really asked one of the dentists who were teaching, and I said, look, could you mentor me for that? And he said, yeah, I will, but I'll take £60,000. And at that time, I thought, you know what? He didn't want to mentor, and that's why he quoted me that. And I realize now that, you know, how cheap that deal was. Imagine if I would have started doing full mouth reconstruction, the second year of my dentistry, I would have been a completely different person than I am right now. Anyway, I've worked my way through for 6 years. I then got frustrated that, you know, I cannot do complex cases. And at that time, I've only found 2 ways to do this. Either become a specialist, which was very expensive and extensive way to do it. So I did not want to become a specialist. I couldn't because I didn't have money for that. Or do a 1-year full-time MSc in Cons from Eastman. And that's what I did. I did 1 year full-time and I gave my all. I worked 7 days a week there. Yes, 7 days, because it was a hospital base. You could work 7 days a week, 7 o'clock in the morning till 11 o'clock in the evening. And I did lots of full mouth reconstruction. I did lots of crowns, implants, and I really gained confidence in doing full mouth reconstruction. And that's where I really got passion of doing full mouth reconstruction, because I saw the lives I was changing. I saw that, you know, doing full mouth reconstruction is much more comprehensive way to treat patient, and you can help patient much better if you know how to do full mouth reconstruction. Plus, it's much easier, contrary to what you might believe, it's much easier than doing sometime a quadrant dentistry where you're kind of struggling with space and you can't give patient really good result. Whereas if you just open OVD, you can get really good space and give patient really amazing result with very easy technique. So that's how I went into doing full mouth reconstruction.
Wow. So Dr. Dev, you have really worked hard after passing the registration exam. You have learned, practiced and experimented with various branches before arriving at your choice FMR. Excellent. Next question. For those who are not aware of the term FMR and those who are not in the field of dentistry, can you please explain what FMR is and why is it vital for patient care?
So full mouth reconstruction or rehabilitation or restoration is a comprehensive dental treatment designed to rebuild and restore the function, health and aesthetic of patient's entire mouth. Now, it could be by just restoration, or it could be by doing implants, or it could be combination of both of that. And as a dentist, I wasn't taught to, and I don't know any university teaches to look whole mouth as a whole. And we initially, which is very rightly so, are taught to do how to become a good single tooth dentist in order to become and start our journey. And that's the perfect way to start. And again, when I'm teaching full mouth reconstruction, I'm telling everyone that, look, you need to be a very good single tooth dentist. If you're not very good single tooth dentist, then what you're doing is just magnifying your mistakes when you are doing full mouth reconstruction. So that's that. However, there is no clear pathway in order to how to progress from doing single tooth to full mouth reconstruction. And that's why I feel knowing full mouth reconstruction is really important, and having that knowledge is very important, because then you can again treat patient as a full patient rather than looking at patient as a single tooth. And no one walks into patient, they don't walk into like with a single tooth problem, in the sense that, you know, if you think about it, patient is a whole, it's not a single tooth. So even though they're coming with a single tooth problem, we still need to look at that tooth, how it fits into patient's mouth, and see if there's anything else we can help them with.
Thank you for explaining this comprehensive approach. Next, is there any particular case or patient story that really resonated with you or shaped your professional perspective? We would love to hear about it.
Well, there are lots of stories. And again, when you do full mouth reconstruction, and this is again, like if you talk to people who are doing all-on-4 or full arch implant bridges, they will also say that it's a life-changing treatment. Same thing, full mouth reconstruction is also a life-changing treatment. So I have lots of stories to tell, but there are two stories which sticks out really heavily to me, and I still remember to the day the faces, the stories for those two patients. One story was before actually I started doing full mouth reconstruction, that I had a patient who really needed full mouth reconstruction. I did that 1 year certificate course in restorative, so I knew kind of what the cases look like. I didn't know how to treat them. So I told patient that, you know what, I know a really good dentist who can treat you. I'll refer you to them and have the treatment done there. The patient started crying. She's like, you know what, I want you to do the treatment. I'm very nervous, very anxious. I don't want to go anywhere else. And I'm sure every dentist listening to this have those patients who are really loyal to you and they really like you. They finally got that confidence in them that, you know, you can help them. But as soon as you tell them that refer somewhere else, they just don't want to listen. So this is what the fact was. And I really felt bad that I could not treat that lady who really needed my help because I just didn't have enough skill set. Fast forward 10 years later, when I treated one of the patients, she needed very complex orthodontics, she needed re-endodoing, bridge refitting, she needed an implant with autogenous bone grafting, denture. So she needed almost everything in one mouth. And I did everything by myself. I'm really proud general dental practitioners because I want to make sure that I can do everything. Although nowadays I concentrate on full mouth reconstruction and implant, I can still do root canal, ortho, and all the rest of it. So I did all the treatment for her because for her finances was an issue. So if I refer her to orthodontist, I know it would cost her much more. If I refer to endodontist, it would cost her much more. So I ended up doing everything myself, give her a discount, and finish the treatment. And she was really happy. At the end of the treatment, I said, could you give us a little bit testimonial? And she said, yeah, 100%. And she started saying things which I did not know. So she basically gave a testimonial saying that, you know, Dev is good and all that. But she said, you know, when I came to see Dev, she said, I was very devastated. I was really low down. And in order to afford to do the treatment, I had to sell 2 of my horses. They were my favorite horses. And she sold those 2 horses. And she cried for literally 2 weeks when I started the treatment. I didn't know, she did not tell me that. Otherwise, I think that would have affected my decision. But she had all that. And then after the treatment, within a year, she managed to get a pay rise from her employer and she bought those horses back. So that was a really good ending of the story. And that kind of gave me goosebumps that, you know, how much impact you can give in patients' life by just treating their teeth. So those are the 2 stories really sticks out.
That is very touching and inspiring, Dev. Next, where do you see the future of full mouth rehabilitation heading? Are there any technologies or trends that excite you or you might think that might revolutionize patient care?
I think it's a very good question where I want to start with saying that, you know, the basics does not change. And this is something really important we need to know. I was trained as an analog guy at Eastman Dental Institute in a hospital at UCL. And again, it's drilled down into my head that, you know, basics never change. The fundamentals never changes. So I still feel that we need to start with the basics first, make sure, and that's what I do in my courses. I teach the analog dentistry first and make sure that they know, the delegates know how to do analog full mouth reconstruction, because until as you know that, it's very difficult to step forward. However, I feel that the way forward is to do digital full mouth reconstruction. I've been doing fully digital full mouth reconstructions since last 3 years. And my mentors, if they see that I'm not using articulators, they will kill me. But most of my cases, 90% of my cases now are fully digital. I've created a protocol around that fully digital because I know that the articulation is still a problem. If I articulate myself, which I've done in multiple cases to check, my analog articulation is much better than the digital articulation. So I'm not saying that digital is much better than analog in that sense, but it's easy. And when you're teaching, when you're learning, sometimes easy is a good way to start. Simply, if you think about injection molding, there are lots of flaws in injection molding technique, and there are lots of issues with that. But if you are going to do it, and if you're really struggling to create that anatomy of buccal composite veneers, then if you do injection molding, it can really give you the result which many times you cannot do freehand. But you need to know the pros and cons of everything. When you are, in my opinion, the digital world is like a double sword. You can get really good benefits out of it, but at the same time, if something messes up, it can be a really big mess, because you're not in control. Your technicians are in control. And many times, people who are doing wax ups, they're not even dental technicians. So they are doing just a computer thing. They're putting the wax up in. They just don't have the knowledge of dental technician, what dental technician used to have. So I've seen lots of time where they would put the wax on the gum. They will not ask that whether you're doing crown lengthening or not. They'll just make the teeth ideal shape, and then that's it. Because the teeth are in the library, and they'll just pop it on the mouth. It's much easier to do that for them. And then I have to really direct the technicians in much detail. That takes me a longer time. But I feel that once I've taught them, hopefully, at some point they will get it, and then it'll make my life easy. But if you don't know analog way, then you will struggle doing digital. And that's why I think the future is digital, 100%, but you need to start with analog.
Thank you, Dr. Dev, for elaborating and stressing on the importance of knowing the basics and analog dentistry. Your enthusiasm for teaching is palpable. Can you please tell us when you found this passion and what motivated you to start writing and teaching others?
Well, all of this is by an accident. So once I finished my MSc, I was top of the league in the sense that I won a Best Student of the Year prize. I had a distinction, and obviously I caught an eye of my professors, and they said, why don't you come at Eastman Dental Institute and teach in our MSc in Restorative Dental Practice program? And that's how I started teaching. They gave me a job 3 days a week as a substantive staff, and I was a program coordinator for MSc in Restorative Dental Practice program, and I used to lead the certificate the whole year of that MSc course. And that's where I really started getting my passion, helping others. Also, because I was just freshly graduated, I could relate to the dentist more than someone who were 30 years, 40 years experience. So I think I really relate to those dentists really well. And even now, I make sure that I keep that, because once you grow, then you forget where you started. And I really make sure that I understand where I'm started and take dentists from there. But that's where my really passion started of teaching. And then what happened was, after a few years of doing substantive staff, my current boss, he really gave me an opportunity to go around his 11 practices. But I then didn't have any time to teach. So I resigned from that post, and I started doing clinical dentistry 7 days a week, working in 11 different practices and doing 1,000 miles a week. That was a crazy time. I did that until 2021, actually. And while I was doing all that, I was getting referral cases. So dentists used to send me referral cases for implants and full mouth reconstructions. And so if they send me cases for implant, then I used to diagnose implant and plan for implant. And many of those patients needed full mouth reconstruction. So as a good referring dentist, I used to refer those cases back to the dentist. And what used to happen is sometimes dentists just didn't do anything, which is bad, because then when I place implant, then if patient wants full mouth reconstruction, then the restoration needs changing. Or when the dentist did something, just didn't know how to do full mouth reconstruction. So I was really frustrated. So what I did was, my first ever course, I did it for almost completely free. And I said, look, whoever are referring cases to me, whoever wants to do full mouth reconstruction, they need to do this course, because I don't want patients to get really substandard treatment. So I kind of developed that course out of frustration, because I wanted to make sure that dentists know what they're doing, and that's how I started really teaching. And when the pandemic hit, I was sitting at home and I thought, you know what, I think it's good time to put all the notes into like a one compilation, because dentists were asking for like a booklet for the courses. So I started doing that. I started writing it, and literally it became a book. So the book, FMR book, started as a notes. And that's the reason I get so many comments from my FMR book that is so easy to read. That's because it wasn't meant to be a book. It was meant to be a notes for my course, where I can give them to delegates so they kind of understand what the course is about. And that's why it's simplified. And I think that worked really, really well. And I've just written and finished. I'm going to publish my implant book. And it's the same thing. The implant restoration book started as a notes and grew into a book. So I thought might as well publish it so that wider audience can benefit from that. And that's how I started teaching and writing books.
Dear Dev, I respect your humility. It doesn't sound accidental, but rather a natural progression. I think your passion and hard work led you to this respected position as a mentor, teacher, and author. Well done. Next, could you please walk us through a typical day in your professional life and how it differs from general dental practice?
Well, contrary to many people believe, I'm still a general dental practitioner. So I'm not in a specialized list. And I think that's another trick I have, in the sense that another quality I have, that I can relate to general dental practitioners. Since, as I said before, 2021, I was fully seeing patients on a referral basis. And I used to work in 11 practices and doing 1,000 miles a week. In 2021, I made a decision that, I want to spend more time with my family. And I was getting on a bit. I'm getting old. So I said, I'm going to cut down. So right now I work in 3 different practices, and 2 of the practices I see on the referral basis. So I see cases for implants and full mouth reconstruction. So on those days, I would have anything like consultation booked in, full mouth reconstruction booked in, or implants. Or if some dentist in the practice, because I know all of them, I've taught many of them, if they are struggling with any case, like say deep margin elevation or something, they'll book a case with me and we'll do the case together, just so I can help them out, I can teach them. And that's how my days are in the other practice. Now, as some of you might know, that I bought a practice in Harrow near Harrow. In that practice, I started doing, since last 6 months, general dentistry as well. So I'm seeing patients for general dentistry because I want to teach my own associates how I work. So hopefully they can learn and they can, progress their career in that way. Plus, I want to make sure that I'm still in contact with reality. And so I'm doing general dentistry in my own practice, plus implant and full mouth reconstruction. But in my practice, this all mixed up in that sense. So, and that helps a lot because I am running a treatment planning club, as you may know, where I teach dentists how to treatment plan general cases. So by doing that, I am kind of a vet-handed dentist, not just a referring dentist who just sees patient on referral basis. So yeah, that's how my days are, very varied. And anything can be on the day. I could have Invisalign fit, or in my referring practice where I see only referral, I might have Invisalign fit where I'm doing a full mouth reconstruction. Before that, I'm doing Invisalign. Or I might have a block grafting or sinus lift booked in, or I might just have a simple extraction booked in, or sometime day full of reviews, which is sometimes nice because it's nice to do something light rather than quite heavy-handed. So it varies.